Good evening. We begin with breaking news. The Alberta government just announced it will begin charging most Albertans for the COVID-19 vaccine starting this fall. Alicia Philberg is working on the story for us. And Alicia, how much is it expected to cost?
Camilla, it could cost Albertans about $110 per vaccine dose. The province says that's what the U.S. Centre for Disease Control estimates, but the fee for Albertans hasn't been determined yet. And many Albertans will no longer be eligible to get COVID shots for free. The fall vaccination program will roll out in 4 phases. For high-risk groups, including seniors in communal living and people with underlying health conditions, COVID shots will still be free. But all other Albertans will have to pay to get a COVID vaccine. Now, there's not a carve-out for healthcare workers, and Albertans will no longer be able to get the shot at pharmacies, only in public health clinics. The province says it's making the changes because about half of the vaccine it ordered last year was wasted at a cost of $135 million. It also points to recommendations in the United States. Under Health and Human Services Secretary Robert F. Kennedy Jr., the U.S. recently stopped recommending COVID vaccines for pregnant women and healthy children, a move which has been widely condemned by medical experts.
I think as well that there's been a lot of misinformation and distrust around the COVID vaccine. And in some ways, this government has actually fed into that. And I think by no longer funding the vaccine, they're sending this message that it isn't important and indeed that vaccines in general perhaps aren't as crucial as people need to understand that they are.
Now, there's no word on whether health insurance may cover this cost. The province says starting August 11th, eligible Albertans will be able to pre-order COVID-19 and flu shots through the Alberta vaccine booking system.
Alicia, thank you so much.